Welcome back to our channel. Today we are diving into a crucial topic in the surgery, inadequate venous drainage. Let's understand what it is, why it happens, and its significance in the clinical side. What is inadequate venous drainage? In simple terms, inadequate venous drainage refers to a poor or insufficient removal of deoxygenated blood from the patient, especially in the SVC, IVC, the right side of the heart. This causes blood pooling, tissue coagulation, and if not corrected, serious complications like edema, hypotension, lactate formation, and even necrosis. Why is venous drainage is important? Veins carries blood back to the heart. It is deoxygenated blood. In the CPV, we are draining deoxygenated blood and we give oxygen to the blood and will return to the patient. It will regulate the normal tissue oxygenation during the surgeries and prevent swelling and pressure buildups and edematous. So these are things prevent in the CPB. When venous return is obstructed or insufficient, it directly affects the tissue health. So we are going to see the causes and management. The first thing is malposition of the cannula. In case we are give too much pressure to put inside the cannula, the veins, the cannula will go deeper into the veins. It will causes rupture in the vessels. The loose purse string switches. Mostly the cannulation will be a single incision, so the switches will be properly done. Inadequate gravity finish. It depends on the reservoir position. The inadequate size of cannula, it depends on the patient age and weight. We are not going to select the venous cannula in the pediatric used to the adult. So according to the age, height and weight, these are the things. We are based on these things, we are going to select the venous cannula size. And the improper snugging, airlock, especially airlock occurs in the venous line, not in the other parts of the CPV. So airlock will occurs in the venous line, completely stop the blood towards the reservoir. So in case we have airlock in between the venous line, we have to double clamp below the airlock and disconnect the venous line and the venous cannula. We can pour the priming solution and then reconnect it, kinking or obstruction in the venous line. So excessive negative pressure causes veins to collapse at tip of cannula, causes obstruction of cannula. It is because of we are using a vacuum assisted venous drainage. It should be 80 mm Hg to 120 mm Hg pressure. So in case we use excessive pressure among these, so it will cause us hypovolemic fluid shift is nothing but edema, poor sedation, excessive dilation, inadequate placement of venous reservoir, improper priming solution in the venous line. So we have to do a proper de-ring in the circuit. So we're going to see our management, a proper cannulation in the SVC, IVC and RA appendage. We know that tying the switches with the proper snaggings. Use vacuum assisted venous drainage, kinetic assisted venous drainage. Use a large size cannula for venous line. So in the CPB we can see a large size tubing only in the venous lines 1/2. It's according to the procedure what we are going to do. Tying the snugging with the wall of SVC and IVC, clamp the venous line below the airlock, remove the venous line from the venous cannula, fill the venous line with the saline solution, replace the cannula. It's a solution for airlock. And check the flow of line and avoid stuff interference near the circuit. The partial clamping of venous line to avoid excessive drainage. Add volume of blood in case there is a sudden emptying of reservoir volume. Add diuretics in case of edema. Administered Vasopressor, reservoir volume should be below the uh, reservoir level should be below the patient bed. Add solution as per the calculation. So the common complications are decreased blood flow to the patient leads to the hyperperfusion. So it will leads to hypoxia and then necrosis later on. Emptying of venous reservoir, it's a major complication in the CPB. So sudden emptying will causes a large amount of air into the patient. So it's an emergency one. Air embolism, cerebral steal, neuroconjunctive disorder. It is because of the air embolism. Lactate formation, this poor oxygenation blood to the patient. So the normal value should be of 0.001. So it is more than that value, there is a lactate formation. So anaerobic conditions will occur in the patient. Metabolic acidosis is the common complication in the CPV. Inadequate venous drainage may seem secondary compared to artery, but its impact is equally dangerous. Recognize it early, fix the causes, and always prioritize good vascular techniques during surgery. If you found this helpful, hit like, share with your medi buddies, and subscribe for more simplified surgical concepts. See you in the next one.